The Centers for Disease Control and Prevention, or CDC, is currently investigating a multi-state outbreak of Listeria infections linked to deli meats. As of July 24, 2024, 28 individuals have fallen ill, with cases reported in 12 states. Tragically, 2 people have died, and all reported cases have required hospitalization. Just to put things in perspective for you, in 2004, 2 people have been infected by bird flu compared to these 28 people. Also, there were 2 deaths from this, and none from bird flu. Just keep this in mind, in case you walk into a pharmacy or doctor's office and are pressured to get the bird flu vaccine. This lunch meat outbreak likely began in late May, and it may be more widespread than currently known. Most of those affected reported consuming deli meats such as turkey, liverwurst, or ham. Please watch my video about lunch meats and how unhealthy they are that will be linked at the end of this video. If you eat meat, you are so much better off to buy your meat, cook it, and slice it for sandwiches. If you have eaten processed lunch meats, the symptoms of Listeria infection usually appear within 2 weeks of consuming contaminated food, but can vary from the same day to up to 10 weeks later. The CDC particularly warns that Listeria poses a significant health risk to specific people such as pregnant women because Listeria can lead to miscarriage, stillbirth, or premature delivery. Newborns can develop severe infections or complications. Elderly individuals are at higher risk due to generally weakened immune systems. And individuals with weakened immune systems such as those with HIV/AIDS, cancer, diabetes, or undergoing treatments like chemotherapy. Listeria is a type of bacteria that causes the infection known as listeriosis. This infection is typically acquired by consuming contaminated food. Listeria monocytogenes, the specific strain responsible for listeriosis, can be found in soil, water, and animal products such as dairy and meat, as well as vegetables. Listeriosis can manifest differently depending on the individual, with symptoms ranging from mild to severe. Mild symptoms may include fever, muscle aches, nausea, and diarrhea. Severe symptoms are possible especially in high-risk groups and may include headache, stiff neck, confusion, loss of balance, and convulsions. One of the most important preventative measures you can take includes avoiding highly processed lunch meats. If you are a meat eater, cook your chicken, turkey, and other meats yourself and slice it for your sandwiches. It's so much healthier. Wash raw vegetables thoroughly. Cook meats properly. Keep food preparation areas clean, separating raw and cooked foods, and lastly, ensure all foods receive proper refrigeration. The investigation is ongoing and no recalls have been issued at this time. Just recently, Aldi did voluntarily pull a lot of produce due to Listeria contamination, so be careful. I just want you to understand that there have been 2 deaths and 28 illnesses, and the meat hasn't been recalled, but 2 people contracted bird flu, and there are stockpiles of vaccines waiting to be administered. Stay informed and take necessary precautions and do your homework before putting anything into your body. For more updates, follow the Ex-Pharmacist channel for health, science, and societal issues of interest. Remember that you are responsible for your health, so act accordingly and stay safe. Processed meats are generally considered unhealthy, particularly when consumed regularly or in large amounts. The World Health Organization, WHO, classifies processed meats as a Group 1 carcinogen, meaning there is strong evidence they can cause cancer. Regular consumption of processed meats has been linked to colorectal cancer. Processed meats are often high in sodium and preservatives like nitrates and nitrites. Excessive sodium intake is linked to high blood pressure, heart disease, and stroke. Nitrates and nitrites can form nitrosamines, which are carcinogenic. Consuming processed meats has been associated with an increased risk of heart disease. The high levels of saturated fats and cholesterol found in these meats contribute to the development of atherosclerosis and other cardiovascular conditions. Studies have shown that regular consumption of processed meats can increase the risk of developing type 2 diabetes. The combination of high fat content, additives, and preservatives can impair insulin sensitivity. Processed meats are calorie-dense and often lack essential nutrients, which can contribute to weight gain and metabolic syndrome. This syndrome increases the risk of heart disease, stroke, and diabetes.